Hello, good evening, and welcome to Sheffield Live. You are watching African Voices with me, Baillor Jalloh. And I've got various guests here today, and we'll be discussing the reopening of schools and universities. But before I start, it's a pleasure for me to be introducing my guest tonight. And my first guest is Juliana Ojinnaka, who is a lecturer at Sheffield College. Hi, Julie.
Hello, how are you? It's Ojinnaka, by the way.
Okay.
How are you? Okay.
My apologies. Juliana Ojinnaka, who is a lecturer at Sheffield College. All right. And also I've got Melissa Simmonds, who is a parent of 2 secondary school children and also an autism activist. Hi, Melissa.
Hi.
All right. Thank you to both of you for joining me this evening to discuss this topic. If I may start with you, Juliana, your take on the reopening of colleges, schools, and universities.
Well, yes, the opening is something that the government has instigated. There are a number of issues around this, in the sense that lecturers and students and parents don't mind schools and colleges and universities opening as long as the place is safe for their children, especially in terms of the COVID-19. As you know, this is a very serious risk to humankind, and it's one of the unprecedented situations that we've had to face in the modern times. So at the present time, as long as the institutions have put in place safety networks for people to go back into work, to study, and parents also feel comfortable with the situation, then there's no issues.
Then that brings in Melissa. You are a parent and also a student at Sheffield Hallam University. Yeah, your take on it.
It's been an incredibly stressful time as a parent to, my daughter is a year 7, so she's just started secondary school. My son is a year 11, so he's doing his 2nd year of GCSEs. And I have little to no faith whatsoever in the government, but I do have faith in the school, that the school want to do everything in their power to ensure that their staff is safe and that the children are safe. But I think the way the system is set up, it's going to be impossible for them to keep our children safe. I think by Wednesday this week, or last week, sorry, there was over 20 schools where there was COVID in. I know of a nursery that it's in. To be honest, even though I was supposed to graduate university this year, but I've put my dissertation on hold until I could get my children settled back at school, because they had to be my priority. But everything is just so up in the air, and I think for me, my thoughts are that the government want people back to work, and in order to get people back to work, you have to get children back to school. So I don't feel that their concern is for the education of the children, because if they did believe that, then I think they would take things more seriously, and they would take their time in reopening the schools. Things would have been put in place more in a more strategic way and a more thought out way than it's being done. This is about furlough ending, the government not wanting to fund people, and them just wanting to get people back into work so the taxman can get his money.
It seems like both of you here have got similar views. But from your side, Melissa, you're saying you do trust the schools, but you don't trust the government in terms of the guidance that they're giving. If I may ask, why is that?
Because I have a relationship with the school, because my son is autistic and has been at his school for 4 years. This is his 5th year at the school. My daughter has now started that school. So I have a relationship with the school, with the members of staff, and I know how much effort they put into my son's education and making sure he's well. So that's why I trust the school. the junior school my daughter's just left, I would have felt very uncomfortable with her still being at that school, because not long after, when the schools opened in Sheffield on the 15th of June, the second day of the school's opening, they broke one of the bubbles at school. The headmistress broke one of the bubbles because one child was unhappy with the group he was in. And so then my faith and trust was completely lost in the school, because there could have been different things they could have done to support that child. So I think there will be parents that don't have any faith in the schools either, but it's just because of the rapport and the relationship I have with the school, which is why I'm saying I have trust in the school. It's nothing more than that. I think that as well, I think that the schools, they don't want to know that they're super spreaders. They don't want to know that their school is responsible for spreading COVID in the community. So I think they will do everything they can to take it really seriously and to try to keep the children and families safe. But I think with the government, I think they're so detached from reality and so detached from working class families, working class people, that, you know, herd immunity for me, in my opinion, is still something they're trying to do. So that's why I say I have trust in them, in the school, purely because of relationship and nothing else.
All right. Julie, from a lecturer's perspective, looking at what Melissa has said, yes, you are not a school teacher, but you are a lecturer at a college, you know, or university. How does it feel to hear that, yes, people like you are getting the trust from parents, but, you know, as Melissa acknowledged, she doesn't trust the government, and you yourself, you're still skeptical.
Well, yes, I think Melissa is quite right. I'm a parent as well. My last son is in the university. One of the things that the university have undertaken to do, and the unions, the UCU, for lecturers, is said to lecturers and the universities that they should postpone lecturing until, face-to-face lecturing until January, simply because the risk is still very high. It's an unknown quantity. We don't know what the extent of this disease is. The government doesn't know, the scientists don't know. And so we have to be very, very careful. We have to tread carefully when we are allowing students back into campuses and so on. So it's for this reason that we have a system of blended learning, so that students are away from the campus, but they can have, maybe when they have a tutorial, they might have a session with their tutor. So it's not in a group and so on. So because we know that this whole thing is likely to spike when there's a group of students banded together. And of course, parents are not there to guide, to make sure that their children are keeping the safe distance and so on. And also teachers are not always there with the students to ensure that they are maintaining the safe distance that the government has actually put in place. So this is making it very, very stressful and anxious-ridden time for parents. And so I do understand what parents are going through. I'm as a parent myself, I'm worried about my son going back to the university to make sure, because we want to be clear that the universities and colleges and schools are keeping to the government's framework of health and safety. There are clear legal framework that they should adhere to, and these should be put in place. So we've got the general, hand sanitizers. We've got the keeping the distance and all the rest of it, and face to face. But we also have to make sure that the lecturers are also safe, in the sense that, especially Black lecturers, we know what Black people have underlying issues to do with health and so on. So it's not just about the COVID, it's the things that existed before COVID came into being. And these are exacerbated by COVID. So we have to ensure that there are risk assessments being carried out, being done, being put in place by this institution to make sure that all our children and the workers are also safe when they go back to work.
Before I bring in my colleague Tchiyiwe, who was joining from home as well, you've mentioned here quite a number of things, but it's quite surprising. You as a lecturer, that you are still skeptical, but you are kind of talking of blended learning here. But do you understand as well from the government's perspective or university's perspective that if students do not come back and students are paying quite a lot of money for these courses, you know, on the other hand, they will not be getting value for money, are they?
Therein lies the problem, in the sense that, you know, what do we put first? We put the children's lives at risk first, or do we put money first? So yes, we know government is we're going to lose a lot of money, whichever way we look at it. Governments are going to lose money, universities are going to lose money, students are paying a lot of money for their tuition and so on. So it's a catch-22 situation. Do we put money first, or do we put their lives first? So we need to think about, in terms of you know, what are the priorities? And for a lot of parents, the priority is keeping their children alive. And for a lot of students, it's being alive. And for a lot of the students who are in the university, they've also got parents who are also concerned about the lives of their children. So they want to keep their children alive, but also they recognize that their children need to, you know, fulfill their educational requirements and so on, and they need to progress. So what universities have done is to put work online, and they're still teaching online. The difference is that they're not doing it physically face to face, you know, human contact is not there, but they're still lecturing, they're still giving the same information that they would have given students if they were interacting physically. The difference is that they are receiving the information online. So in that way, we are all safeguarded. So students will not be losing out. However, what universities have done and what some colleges are intending to do is to put in place some support structure for students who are having difficulty with their studies. Because at this time, it's a very anxious time for students to keep on with their work. And also, you know, this fear of the COVID and the impact on their mental health and so on. This is a big issue for them. They've never had to, none of us have ever had to face this in our lives before. And so this is new for everybody. And so everybody is learning as they go along. And so for the students, especially the ones in the university, there's a lot of material being provided. The schools, however, have to look at ways in which to support the children that are under their guide and so on, and look at ways of increasing the use of online, because my understanding from the regulation I received this morning is that there is an increase in the number of COVID cases amongst the ages 17 to 21 years of age. These are the age of the students who are going into university. And so therefore we need to really be clear what it is that we are putting in place to ensure that these students are safeguarded on an ongoing basis.
Right, I've got my colleague Chihana, who is with us as well. Hi, Tchiyiwe.
Hi, Baillor. Hi, everybody. Thanks for hanging a little bit for me. Melissa, I wondered if you could just talk a little bit about the impact actually of the decision to reopen schools, especially with you being a mother, an autistic mother with autistic children. What has that entailed for your family?
Lockdown initially was very stressful. My children are very different. One coped with it very well, one didn't, because one loves to interact with lots of people. One just likes to kind of keep themselves to themselves. So that was hard. But I found kind of preparing them for getting back to school has been incredibly stressful, and I'm suffering with a lot of guilt, because I think the government has been really good at making parents feel incredibly guilty and saying, you know, our children have been off school for 6 months and they're suffering and you know, they're going to get behind. And so there was a lot of, I think they were very manipulative in trying to persuade us to get our children back to school, first of all. But secondly, as a parent, sending your children back to an environment that I don't know that's safe is very, very scary for me. As a Black parent to autistic kids, it's very difficult as well, because autistic people are exempt from wearing face masks, so we don't have to wear them. But and I mean, a lot of autistic people are very happy about that. But as a Black autistic person, therein lies a lot of difficulties, because we all know what struggles we can face when we are we can be put in harm's way very easily. And so if my son, for instance, was walking around without a mask on, I could see him getting harmed by a prejudiced or a racist person who would make assumptions that he's just being an ignorant young man who isn't wearing his mask. So even though my children and myself, we don't have to wear masks, I've told them then that it's really important that we give it a try. So we do wear masks. My son feels much safer with it on in school. He's a lot more scared of being in the school environment. My daughter struggles with the mask more. She's younger, so she's 11 and just started secondary school, and she's happy to be back in the environment. And actually, since they've been in school, she's not reported feeling worried or nervous there, which I'm really, really thankful for. But me as a mother, I hold my breath every day when their dad takes them off to school. So as soon as they come in, they come through the door, they've got to drop their bags and their flask, because they have to take a flask with water to school. That goes straight in the dishwasher, and they both have to have a shower, and their uniform is kind of put in the washing machine because they have changes for the following day. And it's really sad that we have to be so regimented with children, because children are supposed to be kind of innocent and carefree and dirty a lot of the times. But actually, as soon as they come through the door, I'm having to go through this routine of almost sanitizing them. And I don't want them to feel frightened, but I have to keep reminding them of it. They've both got antibacterial hand gel in their bags. They both, I think they're reminded quite often at school to like wash your hands and use hand gel. But the thing that's different with schools is there is no social distancing, because at that age group, they say, children are less likely to get it. So actually you have the same amount of children in a classroom, 30 plus children in a small classroom. And the only times that they have to wear the face mask is when they're in the corridor, which doesn't make sense to me, because you're in the corridor very briefly passing one another, but then they sit in class and they don't have to wear their face masks while they're in class. You can if you want to, so my son does. But like my daughter's a year 7, my son's a year 11, and we've already within a few days, so by last week Wednesday, which was their first full week back at school, by last week Wednesday, there was 3 different year groups that had COVID in it. So
Melissa, I'll come back to you on that one, because I think that was quite significant. I saw that unravel, but I'll just take you back to Baillor for a moment.
Yeah, having listened to what you guys have already identified here, I just wanted to bring in Andrew Adegbola, who is the Student Union President for Sheffield Hallam University. Hi, Andrew.
Hi.
Hi. So I know you've been listening, maybe not quite a lot, but we've got 2 parents here and also a lecturer who are kind of skeptical with the reopening of universities. You, as the Sheffield Hallam Student Union President, I just wanted to know how prepared, or how are you preparing for students to come back to campuses?
Well, thank you. We've tried our best as the student union. We have been working with university during the summer, planning for autumn section. And I think university, they've put a lot of safety measures in place for students, for both new students and returning students, to support students in order to ensure that we don't have maybe crisis. But I think we have to try our best as human beings, which I believe university we've tried to put in curate a lot of social distancing within the university building and the classroom, and as well a lot of sanitizer all over the universities. They make provision for temperature checking within the university, and as well as by now most of the Hallam students, they've received like 2 face covering from the university to protect them as well. And we are also working with the local community to ensure that students coming back to community, how are we going to support them, both university and the local authority? So we've been putting a lot of measures to support student academic experience and also to support student face-to-face learning and teaching, and as well online learning and teaching.
Yes, kind of putting those measures is one way of kind of trying to protect students. But do you understand as well the concerns that parents are having? Like to say, for instance, in schools where up to 30 children can be in a classroom, where that happens in a university as well, in a lecture theater, where you get sometimes up to like 100. How are you going to make sure that being in a lecture theater, students will be maintaining social distancing and things will be put in place and children and students will be respecting the rules or the new rules? Because people are used to like getting together, doing things in common.
Well, I would say Hallam University, they've put a lot of safety measure in the classroom as well. And most of our lecture theater, we got like between 1.2 meter to 2 meter social distancing safety measure within the classroom. And in most of our classroom, I think for now, based on the new government guidance, the highest we could have is probably 14 students, so that they will be able to like space out themselves within the classroom. I believe with that, we have been sending email across to students to like notify them of the safety measure that has been in place. And I believe with that, parents will be willing to allow their students to come back to the university.
Thanks a lot, Andrew. This one is really more directed to Juliana or Melissa, because you are Sheffield-based, I gather. You're both Sheffield-based. Within days, actually, of schools reopening, we had a bit of a crisis in Sheffield. I think Melissa was about to get into that, where some schools, some classes, some children had to be kept out of schools because they tested positive, and that was obviously alarming. But in a more practical sense, what could have been done differently? What is it that the schools or the public health sector in Sheffield failed to do properly so that we could have avoided such an occurrence? And now that universities are opening, obviously that's even more alarming.
For me, I don't have the answers, but what I will say is, talking to other parents from other schools, every school is taking a different approach, and that is confusing to me. So my nephew's school, COVID was in his class, so they were all sent home. So he has to stay home with his mum, but his brothers and sisters are still expected to go to school. My kid's secondary school, when somebody is found to have COVID, the kids they've come in contact with, so the kids they've been in close proximity with, they have to go home and self-isolate, but the rest of the class have to stay at school. Whereas another school that I've got my friends' kids go to, they sent home the entire class. So every school seems to be taking a different approach, and for me it needs to be uniform, so we know as parents what is expected to happen. It means we feel more nervous, because depending on, it's like Russian roulette, depending on the school your child goes to, they're going to be treated differently. So for me, I would like more uniformity in how the approach that they're taking once it is found.
Thanks, Melissa. And Juliana, do you have any further insight
Yeah.
into that?
Well, I mean, as I said earlier, the Health and Safety Executive have set a framework which the government has instituted. There's a lot of legal basis and framework that institutions have to adhere to, because the whole idea is to prevent and mitigate against infection from this dreaded disease. And the person who's actually going to carry out these investigations and so on has to be trained in the field. They have to know what they're looking for. They have to be sure that they are actually targeting and focusing on areas that are of concern to workers, parents, students, and the general community, because all of these institutions are public sector area, and so therefore the public use them all the time. So they have to ensure that they are meeting the regulations of the government. And if they're not, it's the responsibility of the health and safety executive or person or whoever is responsible for it, for that institution, to report this back to the government or report it back to the council who are responsible for the education provisions and so on. So if they're not meeting, this is why some of these places are being shut down, because obviously they've not met the requirements put down by the government. And so they haven't followed the procedure. They have to ensure that they follow the procedure. There has to be, and also this is particularly for the Black community, there has to be a sense in which the individual risk assessment is carried out. So you might have the generic risk assessment that applies to the whole community and so on, but there are specific risk assessment that has to be applied to the Black community and the Black individuals, both the worker and students. Because there are a lot of, as I mentioned this before, health conditions that are particular to Black community, things like diabetes, some underlying heart conditions and so on, cancers of every type and so on, high blood pressure.
Can I ask you something there, Juliana?
Yeah.
I think you make a very important point about that kind of risk assessing, and I think we definitely need that. So one of the problems that has arisen in Sheffield, especially at the peak of the crisis, was that the community itself took over the role of the council, for instance, and public health, and they were really heavily involved in actually looking after the community themselves. Who would you propose would pick up that work within the community at this point, and how would you make sure that the people responsible are actually targeting the community with the specific needs?
Well, first of all, I think that as a community, we need to be better informed. We need to know what is available out there, what information is out there, and that information has to be in the language that we understand. And also, one of the key things is that this is a massive crisis, but on the whole, it tends to impact on Black women. Black women tend to carry a lot of these issues because, single mothers sometimes, and there are issues about working and caring for families and so on. So they have to carry a lot of this burden. The thing is that we need to be better informed. We also need to be connected with our council as well and raise some of these issues as they come about. So we need to also inform our MPs as well, because there's a lot of things that they're doing at the moment, evaluating the impact of COVID-19. I doubt if a lot of our communities are aware of this. So that information needs to permeate to our people and so on. And also, those people who are working in those areas have a responsibility to educate our communities and make them aware of what's going on out there. So each one has to teach one another. So the responsibility is on us to know what's going on out there, but also we need to take it then further and say to our councillors, our MPs, and then obviously with lecturers as well, inform lecturers if there are issues, and teachers if there are issues, and especially those ones who are in the universities and so forth. There's a lot of things about, the social distancing. So the reality is that people will congregate, people will come together, things will happen. But what we need to be aware is the information that we disseminate around our communities and how we utilize that. So in terms of the question about the impact, we have to ensure that we are aware of our health conditions, because some of these underlying health conditions, some people are not even aware of it. We need to be aware of this and make it known to our community. We need to be aware that the kind of symptoms that other people get is not quite the same as Black people. It's very different for different groups, So the thing about temperature and all, some Black people don't even get the temperature. What they do is that they feel these pains in their stomach and they go and lie down. And in the process of going to lie down, some of them die in that whole thing. Whereas actually, when you start to feel that pain, from what the doctors have recommended, Black doctors have recommended, is that you get up and you walk around and you exercise and so on. So we need to include more exercise in our regime as well. We can't afford to be lackadaisical about it. So we need to be informed. We need to be more proactive in our actions against this COVID and make our voices heard as well. So if we talk about Black Lives Matter, we need to be the ones who raise our voice and say, these are the issues that are affecting us and we need to, do something about it. We're paying taxes in this country. We do a lot
Absolutely.
of stuff.
Yeah.
So we also have to get our MPs working for us and our councillors working for us. It's our responsibility to be informed. We cannot leave our health to somebody else to take care of it for us. We have to be the one who are taking charge of it and being proactive about it.
Thank you. And part of that, just to say, you're absolutely right. And part of that is that what has happened in the last few months is that we've had a BAME strategy being developed by certain organizations and individuals. The permeation of that through the communities is probably something uncertain, because I know, Melissa, you were involved in part of that BAME strategy that was being developed. That was a direct response to COVID-19. And subsequently, there's now a commission of inquiry on racism in Sheffield, but I'm getting the sense that from this conversation that we're having today, that we're still not managing to hit the right targets. The people in the community do not know these things. Melissa, where are you at with this inquiry, with the BAME strategy to start with, and then the commission of inquiry as well?
Regarding the BAME strategy, I left that very quickly. I left that quite soon after kind of putting I put my hat in and I said, yeah, I will take the lead on disability, but I needed a certain level of organisation which wasn't there. And it was a time when, I really had to kind of weigh up, because it's really important for me to look after my community. It's incredibly important to me. But my priority had to be my children and myself. And so I needed proper structure. And I just felt like there wasn't enough structure for me. Maybe other people would have thrived on kind of, just running with that and doing the work. But I had 2 dependents at home where I had to be making them feel safe, making them feel secure, looking after them. And I couldn't do that as well as be part of that group. And, it hurt me kind of saying, thank you for the opportunity, but I'm going to have to kind of decline it. But in the long run, I know that that's better for me. That was the best thing for me to do. I really want it to succeed, because I really want my community to be well, physically, spiritually, emotionally well. I think there isn't enough being done as a whole. I don't think we're educated enough about COVID. I don't think we're educated enough about our underlying health issues. I don't feel people within the Black community have a voice enough to kind of take the lead in it. And I think it's really, really important that we are doing that. I'm finding as well that I'm talking to Black people, because I'm 41, and I'm talking to Black people my age and younger, who are saying that, COVID's a myth. It's not real. And I'm hearing that. Melissa, and I read an article a while back where they were talking about, the misinformation with WhatsApp. And they said, the antis are spreading misinformation about WhatsApp and COVID and about lots of different things. And I actually had to say, it's not the antis. I'm not hearing that from the older generation. I'm hearing it from my age group. And I find it really disheartening to think that some people don't believe that this is real.
Right.
Can I add something to that?
Yeah, sure.
Yeah. The thing about these groups is that when these groups are formed, they're formed by somebody else. They're not formed by the community. They don't even take into consideration the community's views on this group. We have a highly educated medical professions in this country, from different parts of the world, from different parts of Africa, the Caribbean, and so on. People who have in-depth knowledge of health issues that affect Black people, diabetes, chronic heart conditions, and so on, who could be consulted. but the powers that be choose to consult those who they feel that they can manipulate and control. And this is the problem we have. And so therefore, that information is not passing on. If I was called to be in a group and I know that I don't have the sufficient knowledge and understanding of that topic, the best thing to do is to pass it on to the person who you feel has a better understanding of this, because whatever comes out of those groups affect the whole of our community. And then they will turn and say, but you were consulted. No, we were not consulted, because everybody at the grassroots level does not understand what this health issue is about. Now, let me go back to the questionnaire that was sent out to people. I only come across this by mistake, by accident. And I looked at this questionnaire, and I'm reasonably well educated. And I look at some of these questionnaires, and I have to ask myself.
And just to be clear, which questionnaire is it for the Racial Equality Commission or the COVID-19?
Yes. You know, the questions were really difficult for people to understand, for ordinary people to articulate, you know. So it has to be put in a language that people understand. It has to be put in the language that ordinary people can make sense of. So it's no point saying, well, I consulted your community, when actually what you're actually is one of these exercises that says, well, to be seen to be. But actually, the reality is that it's not happening, and so the condition continues. And for those people who think that COVID is not real, they need to have a look at the figures in NHS of Black people who have died. Those people who are reasonably well educated, the doctors and the nurses, the carers, those are real. I know people who have died, you know. So people must get it out of their head that, you know, the COVID is not real. It is real, okay? It doesn't have to happen to you or somebody for you to recognize that it's real. Look at America, look at the people who are dying, mostly Black people. Look at Brazil, the same thing, okay? So we need to get real. We need to educate ourselves. We need to have a voice. Let's not keep saying nobody's gonna give us a voice until we find our voice. Okay, we need to find our own voice. We need to be the ones speaking up and saying, this is what we want. The Black workers in education have had to make a point of saying, we need a different type of individual risk assessment, because the generic one does not apply to everybody. It doesn't apply to the Black people in that sense. It's not enough for us. Okay, because if you're saying that we are most at risk, then let's look at why we're most at risk. This is what happened to the nurses and the doctors in NHS. So that's why we had a high number of them dying. And we don't want the same thing happening in education. We want education to be clear about what they're doing with our children in the schools, with our students in university, and with the workers, the Black workers as well, who are likely to have some of these underlying health conditions, and make sure that their needs are met. Okay, because some of us are located in the occupational structure where these health conditions are worse and so on. So we have to make sure that those people are reached and not left out of that whole community consultation that's going on.
Right, Julie. I just wanted to bring Andrew again into that topic where you've said there need to be kind of strategic point, especially for Black people. Andrew, having listened to what Julie and Melissa have said, what's your take on that? What can you say? What can you respond to that as the student union president? Because you've got so many Black lecturers in these universities, you've got so many Black children who will be coming into these universities.
Well, we have been working with the Black lecturers as well to curate support for students, because most of the Black, let me say aside from Black and Asian and other minority students, others are international students that will be coming from different countries, African, Asian, and the like. And part of the effort that we have been putting in place with universities to ensure that, firstly, when they come to the country, they have like 14 days isolation, which is organized by the president. But as student union leader, we've been discussing with some of the Black and other minority societies on campus on how to keep safe and how to orient students and educate them, especially in order to maintain social distancing and stay safe during this pandemic. So those are the things that we have been doing. And university as well, they have a lot of support services to support Black students as well, because we are trying to put into consideration students that will be coming from different countries that don't really have more understanding of how things work in UK, the social distancing measures that are in UK. So I believe all this will have been added to part of our preparation plan for all the Black and other ethical minorities and minoritized students, and as well international students.
Right. Speaking of that, as you mentioned here, there will be students coming in from various countries. In terms of those who are within the country, some of them might know the kind of the rules that are in place. But for those who would be coming from abroad, like Africa and other places, is there any other extra support that you've got in order to help those people? Because sometimes for those people who have just come into the country, you know, they are new to the country, they don't know what is going on. There should be kind of extra support for them, not only of what you've got, the measures, social distancing, and that kind of thing. And as you will know, most of the international students that will be coming in, I would say are like from Africa and other countries, because in Europe, we'll say most of the kind of legal status or the rules are similar. But those who will be coming from China, India, and places like Africa, you know, things will be totally different to them. It will be totally new to them.
Yeah, thank you. You know, normally we do have special orientation for international students, which we have been put in place as well for now. And most will be online, where we have opportunity to educate international students about what are the things that we've put in place to support them, what are the safety measures that are available, what are the do's and don'ts that are currently here in UK. And aside from that, during their 14 days quarantine as well, we'll be working with them to support them, to give them necessary information that will help them. Because I believe the detailed information are included in their orientation package. And our international experience team as well have been communicating with all the new students, especially international students that are coming through emails and the like. And not let me say the face covering, not only for the returning students or home student, we are giving it out to international students as well.
Thanks a lot, Andrew. A problem I've picked up, I think, from this conversation as well, in terms of having bespoke a bespoke approach, especially for the Black community. I think a problem that we're picking up as well as African Voices platform is that literature that's meant to speak to our communities is not produced. We've also picked up quite recently, for example, more on the African side of things, that none of the West African languages are actually used by Sheffield City Council or the public health here in the city. How do we mitigate that, Juliana? How do we mitigate that, especially as we're going towards recovery? People are going to need to be socially distancing, continuing that, but then there'll be more people as well being asked to isolate, for example, the students that are coming in. Of course, students come in on the premise that they've passed some English level, and so probably that's less consequential. But how do we mitigate that given the circumstances now?
Okay, so I came across this as well myself recently when there was a government, there was a national month, I think it was last month or this month. It's known as National Day of Month of Activity or Exercise or something. And I looked at this and it was in different languages. But then I started to look for the African languages, you know, being an African myself. There wasn't a single African language. So I raised this as a concern. So the person said to me, well, the other communities volunteer their service. We don't get enough Africans volunteering their service. I said, that's really interesting, because when it comes to business, you know, that yields profit, you can find Africans who can produce this information in different languages. But when it comes to this kind of situation that concerns our health, you can't find anybody that can do this. And I find that really hard to believe. So again, as you said before, and as Melissa mentioned before, we need a uniformed approach, not just for the government who is producing the activities and so on, but also in our own communities. We don't even have anybody. And I think one of the sad things we have at the present time is that I can't even begin to say, this is one person who is the leading person in our community that we can go to and say, this is missing, this is what we need to have, this is what we need to put in place for our communities, regardless of their languages, but provide for all of the communities in the different languages that they occupy. So we need to organize as a community. I mean, if COVID has taught us anything, it's the importance of organization, okay? We need to organize. It doesn't matter which part of Africa you're coming from. We need to organize ourselves. We need to be able to say, in that organization, if I call a Nigerian or somebody from Ivory Coast or somebody from South Africa and so on, there'll be somebody there who can translate a leaflet in their language, or they can find somebody who can do that. We need, this is why I keep saying we. The person who's oppressing you is not going to give you everything in a platter. You have to make it happen. We need to make it happen. We need to educate ourselves. We need to produce those leaflets in the language that our people understand. We need to be translating those things. If we know that the government is going to produce, and this is where the rub of the situation is, if the government says to us, we're going to produce this leaflet and we need it in different languages and so on, then we need to take that and run and say, I know somebody can do it in Yoruba language. I know somebody can do it in Xhosa. I know somebody can do it in Zulu. I know somebody can do it in Ga, and so on. So we need to be sure that we are organized. It is our responsibility. We have to organize our communities. We have to be prepared to volunteer as well, to do certain things. There are certain gaps that has arisen over the years. Before, we didn't have this. But as you mentioned before, the older generation don't find issues with certain things, but the younger people have. And we need to ask ourselves why that is. It's because there's been a gap in the process of political activism in our communities and so on.
I'm just going to, Melissa, there's some work you do that specifically speaks to Black politics, actually, in this particular context. Any feelings on the conflation of the BAME concept? Is that what has also contributed to creating this gap in terms of how we engage as well as people of African heritage, be you from the Caribbean or from Africa, the continent, being conflated in the BAME concept as opposed to the Black identity?
Well, I'm doing a master's in autism studies, and I'm sometimes kind of commissioned to be a key worker at conferences and things like that. And one of the things I found is people expect us to work for free as Black people. So a lot of times they will seek out the white autistic individual and pay them for their work. And they will expect me to do things for free. So even though I do kind of understand where you're coming from, Juliana, I do really feel that there will be funding for things like this, where we can find funding where we pay somebody to actually translate the work to the leaflets. There will be people who know of this funding, but they kind of like, it's the gatekeepers who just don't ever let our communities know about it. So I'm always talking about, I'm sick of not being invited to the table. And we talk about that a lot, about not being invited to the table until the last minute. And we're just a tick box exercise. And so with the white community, to them, BAME means everything. It means everything that isn't white. So they will get a BAME representative to come and speak, and then they tick that box and feel that that one person represents every Chinese, Japanese, African, Caribbean, Asian, East Asian, South Asian person, because they've got this one BAME individual. And so they will hire a BAME person. They will hire that single BAME person and feel they have done enough as an organization. And it is not good enough, in my opinion. I really am against BAME. I think as cultures, we are so different. Even me, I consider myself to be Black British. My parents are Jamaican. So my lived experience is very different to my daughter's godmother's lived experience, who's from Uganda and who was raised in Uganda. I was raised in Sheffield. But I think the white community feel that they look at our skin color, they class us as BAME, and they feel, well, their experiences will be exactly the same. So we've gotten our the opinion of one BAME person, and that's enough, and they will just run with that. So I feel we have to hold the white community accountable, because
so Melissa, how can we change that? How can we change that? Sorry to interrupt you there, but how can we change that mentality and make sure we are represented as well? And those who represent us as well, they represent not as an individual, but our interests as a whole.
And I would like Andrew as well to come in on that when Melissa speaks, because I think it's important from the student perspective. Yeah.
We have to be more vocal. And we can't be vocal unless we're educated about it. So it's this really vicious cycle. You know, we have to be more vocal to educate people, but we can only educate people if we're educated about it ourselves. And the older generation were just happy to go to work, come home and be able to provide. And they would keep quiet as long as they could provide. The younger generations, thankfully, are a lot more vocal, and they're demanding a lot more, which is wonderful. But the people who hold the power is still the white community, and they're the gatekeepers. They have the money, they have the resources, they make the laws. And so we kind of, you know, we are kind of oppressed by them, and we have to, as a community, come together more. My experience might be completely different for everybody else's on here, but we're all Black. So as a community, we need to be fighting together to ensure that the Black community is represented better.
I'm going to just
all want that.
Yeah, I'm just going to say that perhaps it's not just the white community. I think even within the context of the BAME community, I can say that there are other communities that are more complicit in making sure that the Black people are kept out of the resource allocation. But Andrew, can you also pick up on this conversation, please?
Yeah, thank you. Well, let me say at the university level, we are really trying our best to create like sense of belonging within the university and the local community for BAME students and as well international students. And part of what we have been doing is we have been working with the university to ensure that, you know, when, like, let me say, for example, September, when students are coming in, I'm from Nigeria, my orientation, my knowledge, my needs are quite different from the needs of students from China and from India and from different countries. So we have been working with the university to establish, like, these are people coming from Nigeria, what are their needs, and look for like staff, students with experience that have more knowledge about their needs and try to educate them. And however, part of what student union we are doing is this year we're trying to like launch something we call BAME mentoring scheme and BAME ambassador scheme. All this is to create sense of belonging for BAME students and as well to help them in like their career development and settling down in Sheffield. And however, I would like to relate it to the local authority that I believe, to my knowledge, I think the local authority as well needs to create sense of belonging for like all the BAME in Sheffield, for us to be able to like live within the city, operate within the city. And I know they are currently doing a lot of issue around racism and discrimination, but all this, they need to put more efforts to improve their work. But within the university, these are the things we are doing. And currently as well, we've been making use of student societies. We have Nigerian society, we have Indian society, we have different society on campus that are ready as well to support their fellow students. So these are the way we've been supporting BAME students and creating sense of belonging within the university.
Thank you, Andrew. I'm just going to pass that back on to Juliana because I think she too has some ideas around this concept, and then Baillor will take over.
Yeah, I have to say, first and foremost, that education is power, and education is the key. And a lot of our people are ignorant. You know, there used to be a saying that goes that if you want anything to be missed, put it in a book, because there's a notion that Black people are not going to read it. Okay, so education is the key thing. We have to educate ourselves about our history, about where we're coming from. Even those people who say that they're Jamaican or whatever, you need to go back to your history and find out where your origins are from, okay? So we need to educate ourselves. That whole notion of BAME is something I don't use. I don't use it. I'm in education and so on. There was a reason why Black was used to include, all the different groups. And that is those people who have had a history of colonization, slavery, oppression, exploitation of their resources, neocolonialism, and so on. So if your country doesn't fall within that, or your nation doesn't fall, then it was a political term, okay? So because there's no such thing as a Black land, but you have African land. So we have identity, we are African, okay? I'm an African woman. And when I really go down into it, then I can identify myself along the line. Now, the older generation, we are saying that they came and they worked and and that was it. Well, the reality is that the older generation were the ones who paved the way for a lot of us. They fought for their rights. They agitated for their rights. What we have is a gap in between those generation and the generation we have now. Because what happened in this country is that when Section 11 money was coming in, the government developed this process whereby they recognized that there wasn't enough Black people within the structure or working within the structure because of racism. They had to put some money out there. It's a temporary measure. But what it did was it created a Black middle class who had children who have become, if you like, entitled, and therefore don't think that they have to do certain things in order to achieve certain things. So this is where the problem lay. And therefore, political education that other groups have been educating their children in does not exist within our communities as it used to be. We don't have community centers anymore where young people go to find out a bit more about themselves. Before in Sheffield, we had Sadaka that was flowing, that was active. You had different languages being taught in there. You had Amharic being taught in Sadaka. Students were being supported with their education. We had Saturday school, and we're learning about their culture. Now, all of a sudden, all of that was done out of kilter, and we don't have the resources, and we didn't have the resources to keep it going. And this is where we need to be organized. This is where we need to bring ourselves together and begin to think about, if we don't work as a group, we're going to become annihilated. And I don't mean physically only, I mean psychologically as well. So it's something that we need to really work on. We need to, as a community, work on, as Melissa was saying, the thing about being Black, physically being Black, ethnically being Black, and racialized Black, and work towards making our voices heard. BAME was brought in as a divide and rule tactic. I agree with you. It's not the thing that it just happened overnight. It's something that was thought of. All of a sudden we have this different, whatever. The reality is that as a Black person, the first thing that gets seen is your color. There's a Black people who are getting murdered on the streets. George Floyd was a Black man, okay, in a racialized form. But what's happened is that the powers that be hijack this and they take it away from what the reality is. And so a lot of our people as well, because we are miseducated, we jump on the bandwagon, we don't ask any questions. And because we don't have any organization, any structure that would help us to understand what's going on, or educate to understand what's going on, we follow suit. And in the process, we lose out as a community. And that's what's going on.
Well, unfortunately, because of time, we'll have to leave it there. But thank you very much for joining us on African Voices platform. Really appreciate your time and your expertise here. Basically, what we have here today is a very, very good conversation about this very important topic. Thank you very much, Juliana Ojinnaka, who is a lecturer at Sheffield College, and
You're
Melissa
welcome.
Simmonds, who is a parent and also an autism activist here in Sheffield, and Andrew Adegbola, who is the current Sheffield Hallam Student Union President. Thank you all of you for joining us on this platform today. This show was presented by myself, Baillor, Jalloh, and my colleague, Chihana. Until next week, that was African Voices, and have a very good evening.